governance and leadership on the WHO European region. To this item, let us now commence our discussion under agenda item 7. Relevant document can be seen here on the screen. Under this item, and the Regional Committee has been provided with this year's 2024 Accountability Report, which presents an overview on how WHO Europe is resourced, structured, managed and governed. The SERC considered the outline of this year's report at its meetings in January and March, and I am pleased to see that SERC's feedback has been taken into account in this report in front of you today. Under this agenda item, the Regional Committee will also consider 6 new applications by non-state actors not in official relation with WHO to be accredited to attend the sessions of the Regional Committee. In addition, it will review the status of the 25 non-state actors accredited of RC68 and RC71. The Regional Committee will be invited to adopt the related draft decision. For this sub-item, delegations are advised to contribute through written statements. Before moving forward with this agenda item, I would like to give the floor to our Regional Director, Dr. Hans Kluge, for his introductory remarks. Dear Hans, you have the floor.
Thank you. Ladies and gentlemen, participatory governance is the cornerstone of trust, transparency and accountability. Last year in Astana, I was delighted that at the midpoint of the EPW, we presented you with our first accountability report, which gave a snapshot of how Euro is managed, led and governed. This year, we have submitted our second accountability report for your consideration. It includes an enhanced overview section on WHO Europe's operating model, including its physical presence and human resources. Strengthened links between KPIs, I'm a strong believer of key performance indicators, and analysis, and measures to improve readability. User-friendliness is very important also. Now, some highlights on the business operations. Following 4 years during which the region experienced massive growth, indicators point to a stabilizing situation now and a new normal, with greatly increased staffing and implementation activities. Euro put in place sustainable structures to meet the increased demand for what we call enabling services, while moving to ensuring a safe, healthy and supportive workplace for the staff. I would point out the shift of enabling functions from Copenhagen to Istanbul has progressed well. Now seeing the benefits of the expansion it allowed through the ability to manage the increased volume better. Procurement alone tripled from 55 to 170 plus $1 million, as an example. It also allowed reduced recruitment turnaround times. So there is this myth that in WHO it takes 1 year to recruit. It doesn't have to be like this, and we prove this. And more capacity to support assurance activities and ability to explore new mechanisms to support implementation through the use of modern technology. For the first time, we have also an officer now on artificial intelligence, and speaking not about technical assistance, but inside the office, to make our own offices more agile. And I would like to comment here the responsible director of the business operation, Mr. David Allen, who led this transformation to Istanbul. The Kaizen spirit something I strongly believe in. Kaizen means step-by-step improvement of operations by involving all employees. It's a Japanese concept. The Kaizen spirit remains the guiding principle and the bottom-up approach to ensuring efficient systems and procedures appreciated throughout the region. Safeguarding our staff and ensuring no negative impact on populations are key priorities for myself and all Euro staff. This year I appointed a respectful workplace coordinator in my cabinet to bring together the multitude of initiatives being carried out, because if you list all the initiatives, I mean, one can get lost, really. I mean, there is a lot happening, regional and country and headquarters, so we brought them together, we made a list and synergized, particularly in relation to findings from our regular psychological safety service. As I mentioned in my Hans talk yesterday, we were the first major office conducting annual staff and well-being service. And actually, we learned a lot there, Jonas, from Denmark, who has this very long-standing, it's really evidence underpinned, very, very helpful. But then we asked each of the teams to discuss it with their teams, because it's very context-specific. One team may work as much as another team, including in the weekends. One team will say they're burned out because of this, the other team not. And one factor, for example, is the behavior of your first-level supervisor. I had this experience of not so nice, to remain diplomatically, not so nice first-level supervisor when I was an officer and had to work very much. This frustrates you a lot. A supervisor who motivates you with emotional intelligence, who is a human being, family, then workload for many people is not such an issue. Next one, leadership and partnerships. Over the past 4 years, I have taken stock of how the regional office works with member states. Remember the first modus operandi I mentioned yesterday, to keep permanent and close contact with each of the 53 member states. We are here to provide services to the member states. This reflection has strengthened our existing efforts and introduced new collaborative approaches outlined in the country strategy. My vision 5 years ago was that this office here has to be relevant and useful to all 53 countries, taking into account that we are the most varied region in the world. We developed with and for member states and adopted by all 53 2 years ago the country strategy. It embodies my personal commitment to put countries at the center of everything we do. And we have seen some tangible progress. A greater shift of staff and other resources from regional office to countries. One of the first questions I got by the regional evaluation group, 19 June, was one of the esteemed countries, right, that I spend a lot of time outside of the office here. How do I manage then the people inside the office? But we also have to realize, my dear friends, that 66% of my staff is outside Copenhagen. So if 66% of my staff is outside Copenhagen, I think it justifies that I spend a proportionate amount of time outside Copenhagen as well. There is a more strategic approach to how WHO and a country agree on priorities and approaches. A more responsive support using country support teams. I think a good example was the work we did with Belgium on non-communicable diseases and public health, where we put different teams from different divisions together fast. And then a new cooperation with countries that do not have a country office. Our first ever country impact report showcases real-life examples of collaboration in each of all 53 member states. And congratulations to Christina and her team for putting this report together. The strategy also paved the way for a new engagement plan with non-state actors this year, reinforcing our commitment to working with NSA and civil society. I myself was very inspired of that meeting on Monday, because it's very difficult nut to crack. I can understand as the NSA there is very limited time to intervene, which, after all, this is a member state governing body, but to get the real input, we need more time. So to have this day, and I want to thank, in particular also France and Slovenia for participating at that inspiring meetings on the NSA is very important, if we are serious about leaving no one behind. All these activities for greater country impact have been guided by this year's SCRC subgroup, and again commending Olivia and dear Bjorn, we're very much looking forward to continue this with you. Finally, some highlights on governing bodies. In 2023, we took the approach of working with an external specialist in institutional governance for Euro's traditional 5-year comprehensive review of governance, which was endorsed by RC73. Under the guidance of the SCRC subgroup on governance, and thank you again, Thomas, the review was based on a participatory approach in which we involved member states through interviews, briefings and other means to shape the content of the report. I thank all member states also for your patience with me these last years, because governance is very important, but not easy. Not easy. When I started as region director, I thought I had 53 bosses. You know, it's already quite a number. But then I understand there are many bosses also sitting in Geneva, you know, in the permanent missions. And then you have a lot of, you know, pseudo-bosses in the press and go on and on. I think the regional director must definitely be the job with the most bosses possible. But first and foremost, the member states. But for this, we need to do thinking. This approach was chosen because we wanted to be transparent, accountable and responsive to the input provided by member states, so that the report presented in RC73 reflecting your views. It enabled to drive cultural changes we wanted. Here I also want to thank you, all the ambassadors in Geneva and missions, to work closely with Gabriel. Gabriel, in her my special representative towards the missions in Geneva, which is very helpful, really to further synergize and streamline between capitals and the missions. Then working with the subgroup on governance further, we're taking now forward the recommendations. I'm very committed to implement those recommendations of the 2023 governance review. And really, again, I learned a lot. And of course, the overall guidance came from the entire 31st SCRC, so diligently chaired by you, Professor Pistol, really. It's not to flat, it's really true. Supporting member states to exercise participatory governance, again, is very important to maintain trust. Because I'm asking countries, you know, you're my friends. I say, why I hear that countries are giving 1 billion to this organization and 1 billion to that organization, and then WHO gets 100 million. And what I often get also is that it's not easy always for member states, and speaking in general, not necessarily about euro, if a country gives funding, how it is output, which is a bit, let's say, logical, because we are a normative agency. It's not 100 million and we save so many lives because we gave so many medicines. So we need to be much more smart on that one. I look forward to your comments and inputs in the 2 sessions today on leadership and governance and program budget matters. Remember that with you, Professor Pistol and the CRC, we decided to move this from day 3 to day 2 in order to allow enough discussion on this one before the end of the RC. So please, as critical friends, give your input according to the triple F: free, frank and friendly. Thank you.
Thank you very much, dear Regional Director. I would like to give the floor Now to Mr. David Allen, Director Business Operation, who will present some key highlights from this important area. Please, Mr. Allen, you have the floor.
Thank you, Madam Chair, and thank you, Hans, for the introductory comments. So indeed, the regional office staffing continues to grow, with a 17% increase since the end of 22. Notably, the increases are mainly in the National Professional Officer category, which increased by 33% during that period, displaying a concrete shift of resources towards the country level, where 51% of our staff now serve. While most of the growth in staffing since 2020 was reliant on the emergency and therefore of temporary nature, it is important to note that during 2024, the overwhelming majority of recruitments have been for longer-term positions, and we see temporary contracts now starting to reduce. This growth demonstrates our effectiveness to use available resources to deliver on the EPW commitment to prioritize impact at the country levels, with only 1/3 of staff in Copenhagen and the rest in country offices and other offices directly serving country needs. The transition to this new distribution of staff strength was done maintaining strong gender parity at all levels of staff and attracting talent from across all WHO regions. With 90 nationalities represented, Euro leads in this indicator across all regional offices. The emerging HR model will require full funding of our biennium program budget and sufficient percentage of flexible resources as opposed to funding tied to specific technical areas. The final expenditure levels for the 22-23 biennium reached $745 million, representing a 112% increase over 2018-19's 352, and a 46% increase over the 511 million expenditure in 2020-21. As displayed in the slide, this increase was mainly attributable to the exponential increase in goods procurement from 16 million in 18-19 to 195 million in 2022-2023, and its relative proportion of overall procurement that made up 50% of all expenditures in that biennium. We must note that the almost tripling of expenditures where WHO uses government partners or NSAs to implement through DFCs and grants, a trend that is continuing also in 24-25. Notwithstanding the start of reduction in emergency resources for the region that we are seeing now, so far in 24 we're still going through the same expenditure rate as in 22-23, although with a considerable reduction in goods procurement and an increase in other areas, particularly staff costs. Again, reaffirming the need for a fully funded PB with sufficient flexible resources to sustain this business model, reflective of member states' demands of WHO in the region. With the exponential increased implementation, we continue to maintain strong oversight and compliance in the region, making us a trusted partner for member states and contributed entities. In effect, we are compliant with the external auditors. We had 3 internal audits that we've been managing. The Turkey, throughout the earthquake period, were able to, the country office and the Gaziantep office, all the recommendations, being the only country office experiencing multiple WHO to receive partially satisfactory with rating from iOS, concluded all its recommendations. And Azerbaijan, we just received it in June, and our teams are working on it, and we have dedicated support from Copenhagen and Istanbul traveling to the country office next month to manage. As mentioned in the previous slide, with ongoing emergencies in the region, our way of working has been changed drastically in recent years, with grants to governments and NGOs to strengthen the health development capacities in countries becoming a new norm and a substantial expenditure category. To oversee these expenditures, we have successfully implemented reforms to the policies on managing implementing partners and undertaking financial assurance activities for grants provided by WHO. The aim is to gain assurance that funds transferred by WHO are used to achieve results as intended and reduce transaction costs according to the respective risk profiles. While we have been active across all our country offices, it's worth pointing out as an example that in a very fluid emergency operating environment in Ukraine, we have successfully introduced substantive assurance activities, including audits and spot checks through external audit companies, ensuring accountability. We found these audits are very effective in preventing fraud, corruption in the emergency context. In parallel to implementing these new systems, we have prioritized capacity building throughout Europe on the WHO anti-fraud and anti-corruption policies to equip staff with tools and knowledge to recognize and report red flags when managing these implementation instruments. In effect, 2024 is marked by being the first year with a substantial increased delegation of authorities to decision makers in the country and regional levels as part of our efficiency agenda and prioritization of impact at country level. While implementing this decentralization in synergy with HQ and the WR's Action for Results Group, structures of offices are now under review and dedicated capacity building efforts were initiated to support management of the enhanced accountabilities in business areas such as procurement, human resources, and financial management. Such magnitude of accountability decentralization would not have been possible without the regional director's decision to establish the enabling hub in Istanbul, thereby considerably expanding the region's operational support capacities and shifting the services closer to the eastern part of the region, where most of our implementation takes place. This at no additional cost. This slide shows Kaizen, as Hans mentioned, a Japanese word that means continuous improvement, and he has placed as a central concept for our efficiency and efficiency agenda, as an important element to the progress we have made in business operations over the years, particularly with establishment of the hub in Istanbul. Following the soft launch of the hub in July 2023, by June 24, more than 2/3 of the anticipating staffing was in place, with notable achievements and enhancements already tangible. As examples, already by mid-2024, staff from our business operations teams have carried out more than double the average yearly trips to country office compared to pre-2020, providing support and guidance to our our country office operations and building their capacities. This has been greatly facilitated by Istanbul's strategic location with direct flights to 100% of WHO Euro offices locations. The increased numbers of professionalization of teams has allowed expansion of capacity building and training activities for colleagues managing accountability functions. And here I would mention that the country office colleagues have been key in this, also traveling to Istanbul and supporting in filling gaps while we grow. We've also introduced 20 new service lines, from assurance functions to security to artificial intelligence to digital governance and the like. The expansion and the new location has attracted new colleagues from across WHO, other UN agencies, from private sector, providing new approaches and ways of doing things, reaffirming a service-oriented culture, supporting innovation towards continuous improvement while maintaining competence, gender balance, and geographical diversity. We have become more agile and resilient, with our teams starting to be able to plan time for continuous learning and activities without impacting on business continuity. And we've been able to provide direct support to processing transactions for several country offices with reduced capacities. In line with the ambition of the EPW, increased country-level presence and growth of the workforce, I'm grateful for the regional director's ambition, commitment, and support to enhance enabling functions and business operations towards more effective delivery of WHO Europe's technical work, while ensuring transparency, accountability to member states, and the capacity of our workforce to drive strategic initiatives across the region. WHO Europe has a zero-tolerance approach to sexual misconduct. In action against sexual misconduct, any form of retaliation against those who report sexual misconduct or participate in an investigation of allegations of sexual misconduct. The regional director has taken this corporate priority very seriously, and as a region, we are both well aligned with corporate efforts and progressing well with expected actions to support a zero-tolerance approach. Namely, The new sexual misconduct risk escalation process creates a common PRS risk language and enables leadership to make informed decisions and act in a timely manner at the right level. We have increased our human resource capital in the area with 33 trained part-time focal points, 4 full-time technical officers in graded emergency countries, as well as our regional coordinator. 100% of our head offices completed the WHO sexual exploitation and abuse risk self-assessment with an overall low risk rating. We have rolled out the UN Partner Portal for Sexual Exploitation Abuse Assessment, assessing whether implementing partners can prevent, identify, report, and respond to SCA incidents appropriately. WHO Europe PRS strategy also includes a spotlight on the behaviors essential for a safer workplace culture. Indeed, as Hans was mentioning, safeguarding our own staff from negative or unsafe workplace environments remains critically important. In past years, we have presented the multitude of surveys, trainings, briefings, and other activities we carried out related to ensuring a psychological safe environment of our workforce. This year, we report that our RD has decided to elevate efforts further with the establishment of a respectful workplace program and appointment of a coordinator in March, tasked with bringing all these efforts together, aligned with a clear strategy aimed at addressing chronic issues and specific pain points. I'm therefore very pleased to inform the Regional Committee that 67% of the Euro workforce participated in the 2023 workplace survey monitoring psychological risk. This is up from less than 30% in previous years. Our coordinator, the regional staff physician, and staff counselor, and 3 coaches supported our country offices and regional teams to have these discussions that Hans mentioned. And by now, 80% of regional teams and 60% of the country offices have had these meetings and identified actions that they will take and actions that have to be taken at the regional or global level. And RD has held 2 town halls to get feedback on these issues. All these activities helped us develop now a strategic action plan, which will be overseen by the Respectful Workplace Advisory Committee, with clear expectations, indicators, and focal persons to address the issues in our control and to encourage the important cultural change where all colleagues recognize the importance of and share accountability for a respectful and psychologically safe work environment. Thank you.
Thank you very much. Thank you again, dear David. Now I would like to give the floor to Dr. Christina Mauer-Stender, Acting Director, Division of Country Support and Partnership, who will present the elements related to leadership and partnership, including engagement with non-state actors and associated decisions. Please, Dr. Maurer, you have the floor.
Thank you very much, Madam Chair. Good afternoon, esteemed colleagues. The coming minutes of this session will describe principles and progress, but is at the heart of WHO Europe, how we work together with countries to realize our shared health ambitions. WHO Europe country strategy, co-produced with you, all countries, and adopted at the 72nd Regional Committee, describes how WHO Europe collaborates with countries and the ways we can strengthen this further together. Its implementation continues to be guided by the Standing Committee of the Regional Committee of Subgroup of WHO Europe's work at the country level. I'm very grateful to all those that have been involved in a subgroup, including its most recent members and the chair, already mentioned by the Regional Director, the excellent Olivia Wigsell, Director General of Public Health Agency of Sweden. This year, the subgroup identified 3 themes to guide their work. Those are togetherness, innovation, and health impact. I will spend more time on these shortly, but I want to highlight upfront the country impact report, which was already also mentioned by previous speakers. This is the first ever that we have compiled a story from every country in the region to learn from our work together. We're here together in Copenhagen this week. We have gathered numerous times this year over the last year, and we will continue together, we hope. We have developed our forums for sharing across the region and understanding the health goals of each country. The role and network of national counterparts has been further progressed this year with new terms of reference and further engagement events. And I think we were witnessing the launch of national counterparts yesterday at the regional committee. The sub-regional partnerships and networks are another growing force of our collective leadership. And none of this would facilitate change if we didn't translate it into strategy and action. That's why we have developed a new approach to the country cooperation strategy, and it is what makes possible a progress across sub-regions, as we heard yesterday. Strengthening tobacco control in Western Balkans, enhancing membership of small countries, and increasing health investments in Central Asia. We have continued to develop our offer for all countries, tailored, strategic, and responsive. Our workforce in countries has grown according to the core predictable presence, and we have strengthened professional development, including for health leadership and health diplomacy. We are also increasing delegation of audit to countries to couple enhanced planning with a greater ability to act. The Pan-European Leadership Academy continues to develop health leaders at all levels and is fully aligned with the global WHO Academy to be launched on the 17th of December in Lyon in France. And we have also new ways of working with countries, and we are very proud of these. I just mentioned two. The country support team is a deployment of WHO and country experts available to any member state, delivering a jointly defined public health output. It has seen success in Belgium, as the regional director already mentioned, but also in Malta, Germany, and Georgia, and helped us to test this new approach of co-production with countries. The other example is country counterpart, which is a senior member of the staff in the regional office, designated as a liaison for a specific country without a country office. It has helped us to strengthen collaboration until now with Germany, Portugal, Ireland, Malta, Spain, Netherlands, and Italy. Of course, whilst we continue to enhance how we work, we need to balance our ambition with the resources available. And this brings us back to impact. I hope you have all seen a copy of a country impact report. I'm not going into details. What I want to highlight here and now is its process and structure. We invited colleagues from every country and those from the WHO working with them to highlight collaboration, what we can learn from. Through interviews, we developed the stories in their words and from their experiences. In so doing, we ensured we learned not only about the work and impact, but also about how it was brought about and what lessons will help us continue to strengthen our collaboration in future. I encourage you all to read those stories, your stories, share your reflections, and disseminate them in your country. Finally, I want to bring you back to a theme of togetherness and one of the original building blocks for collaboration in a country strategy, our rich regional resources. We have worked with technical focal points on revised terms of reference and ways to strengthen their networks. Multi-stakeholder networks continue to blossom, including U4Health Network, Mental Health Coalition, just to mention few. We have consulted our vast network of WHO collaborative centers to understand how they are supporting countries and what can we do more together. On Monday, we launched a new plan to strengthen our engagement with non-state actors, organizations crucial to helping us understand the needs of people, communities, and those too often left behind. I will close by saying that there is progress to be celebrated, but there is more to be done together, and I look forward to working with you, ensuring until it's done. Thank you very much.
Thank you very much, dear Christina. And last but not least, I would like to invite Ms. Gabriela Jacob, Regional Advisor Governance, who will present highlights from our work on governance over the last 12 months, including implementation of the government's review recommendations from RC73. Dear Gabrielle, you have the floor.
Thank you very much, Madam Chair. Good afternoon, everyone. As RD has already said, participatory governance is essential to foster trust between WHO and member states of the region, and particularly in these complex times. And I'd like to express appreciation to the member states who yesterday and indeed this morning supported the governance reforms that we've been undertaking in Euro. We really appreciate that support. The overall programme of this year's 31st Standing Committee has been informed, as you know, and as RD has said, by the outcomes of RC73 and has been driven by the implementation of the recommendations of the governance review. I'd like to express my appreciation to the Standing Committee for our work together over the past year, and also to acknowledge the tremendous support from our previous regional coordinator, Slovenia, and from our current regional coordinator, the UK, as well as the significant contribution from Ms. Michaela Told, our independent governance consultant, who is the critical friend for this implementation process on your behalves. Next slide, please. This year, priorities have included developing key performance indicators on governance issues that can further improve the accountability and transparency of governance processes and can be included in our annual accountability reports. Strengthening the role and purpose of the SCRC by exploring further measures to increase its visibility. Further improving the transparency in the pre-assessment and selection process for nominations and elections, and also fine-tuning the standard operating procedures and processes for the establishment, renewal and discontinuation of GDOs in consultation with member states of the region. Efforts have been undertaken to improve the onboarding of SCRC members, real-time communication with member states, including timely and concise reports of SCRC meeting sessions, as well as outreach and sharing of SCRC members' experience, as was the case in September when the Chair convened a session with Group B member states. In addition, SCRC Chairperson and Vice Chairperson have been informally briefing member states on the activities of the Standing Committee, including through regular briefings for the permanent missions in Geneva, hosted by the Euro-Regional Coordinator. Next slide, please. Specifically on the timely submission of documents, it is a necessary condition for the efficient and effective conduct of governing body sessions. To support the progress we have been making in this regard, RC73 approved the introduction of Rule 22 Quinter to the Rules of Procedures, specifying that documents relating to the provisional agenda of the Regional Committee should be made available in the relevant languages not less than 6 weeks before the commencement of a regular session of the committee. This new rule prompted the Standing Committee through the subgroup on governance to review our current KPI and governing bodies used last year in the top-line accountability report, and to consider further indicators in line with the relevant recommendations of last year's governance review. From these deliberations, the SCRC has recommended a new KPI for Regional Committee consideration this year to reflect the new rule and the rule of procedures. The new KPI will have its baseline set in 2024 following this session of the Regional Committee and will be introduced in next year's accountability report. But this is only part of the picture, I think, when it comes to the effectiveness of Regional Committee governing body meetings. The number and length of RC documents also has a bearing. In total, 48 documents were submitted to RC73, compared to 75 for RC72 and 57 for RC71. So this represents a 36% reduction in the number of documents between RC72 and RC73, but the accompanying reduction in the total word count was smaller, less than 10,000 words. So this means that fewer, but generally longer documents were submitted for RC73. The reduction in the total number of documents aligns with requests from member states to streamline the agenda and to deliberate on a more limited number of items. But we need to make some further progress on the length and conciseness of the documentation to ensure efficient and effective governing body meetings. And this will also assist in the timeliness of dispatch to member states in order to enable all member states of the region to contribute equally to the deliberations. So looking ahead to next year, Our priorities will include on the implementation and recommendations of the governance review, implementation and monitoring of KPI 21 and our new KPI 22, further work in relation to nominations and elections, including piloting the presentation of candidate countries for Standing Committee for the 2025 cycle, and also measures to further strengthen the visibility of the SCRC. There is more work that we need to do to make the work of the SCRC fully visible to all the member states of the region. A little later this afternoon in the programme Budget Matters session, we will hear further about some of the financial challenges facing us, which are also reported in the accountability report. So, mindful of these challenges and working with the Standing Committee over the next intersessional cycle, we would also like to look at possible efficiencies in governing bodies, not necessarily doing more with less, but doing more with what we have, including with the use of electronic tools. And we will use this year's governing body cycle as a baseline for that work. So with that, Madam Chair, I will conclude and pass the floor back to you. Thank you.
Thank you very much, dear Gabriel. Yeah. And now, because we have to take a break, I would like to suggest you to start our break with a brief stretching session. We will strongly embrace the powerful benefit of taking healthy breaks for our overall well-being. After spending an extended period on our seats, we are delighted to have representatives of the International Sport and Culture Association here with us to guide us through. So, we will have our very nice, thank you. And we'll resume after almost 30 minutes, 15:45, please. Yeah?
Brad, you go there. Yeah. Thank you. Thank you for standing up. We are ISCA, the International Sport and Culture Association, and our mission is to make sure that everyone has their human right to move. And we are here to activate you a bit after being set for so long with our friendly colleagues whose name I cannot pronounce.
I'm here for the Danish pronunciation. It's called Rødovre og Omegns Gymnastikforening.
And we're going to do some stretches first, and then some very fast mind tricks for both your body and your mind to wake up a bit.
Body and soul. It's great. It's the whole holistic experience, you know. Yeah. All right. So I think we're going to start from top down. You can easily get a habit of looking at your phone and looking down too much. It can put a lot of strain on your neck. So what we're going to do to start off is like trying to look as far back as we can and then tilt your head forward again. As far back as possible and then forward again. And now, even though it might look a bit silly, but keep in mind everybody is looking up, you open your mouth when you look up so you can go even further and then you close like this. And then you do a few of those chews.
Beautiful.
Yeah, extremely silly, I know. But it works, it works. It really stretches out the front of your neck. And what we try to, the core concept we kind of stretch out today at work is that a lot of the painful spots is actually caused by the opposite tightness in the opposite region. So if upper neck is hurting, it's probably because of a lot of tightness around your throat. Likewise, if your upper back is hurting, it's probably tightness around your chest muscles, your pecs. And that's what we're going to work on now. So we do a little bit of shoulder rolls. Oh yeah. You're pros. It's not your first shoulder roll, I can see. And the forward one. Yeah, it is a health organization. Very clear. We can do a bit more tricky one, a bit more stretchy. Goes like this. And switch. Yeah. I had all the clicking of the what's it called?
The shoulders.
Ligaments. If you can hear them, it's because they're holding out. All right. So likewise, there's just you should do these longer than we're going to do right now. But also, if you have pain in your lower back, these following exercise can be good. It's the hip rotation. Oh. It's because your hip flexors might be your very tight hip flexors might be the reason that your lower back starts to be very immobile and starts complaining. Or the other way around as well. Ah, yes. It's also fun, right? Yeah, this one requires a little bit of balance. I'm experienced. You can use your table if you also want, like this. Oh.
Good job.
Really try to, if you could keep your knees back, and then try to pull as far. Yeah, it's difficult. And we switch. Try to push your hip forward, really to get the stretch to the hip. I think that's what we got for the stretches. More inspirational than you should do them longer times, multiple rounds maybe.
That we can repeat it. This is also to learn a bit. And now 2 very fast mind tricks. One requires personal coordination. The other one requires a bit of competitiveness. For the first one, we're gonna have one hand put like in the circle, so your thumb and your index finger in front of you, and the other hand goes like a gun. And then you try and switch.
Oh.
And switch again. And switch. More, faster. The faster you go, the harder it gets. And it's okay if you don't manage, because I haven't learned it yet. And I haven't been doing it for a long time.
Oh.
It's much harder than it looks. And then for the second and last one, we're going to ask you to find a pair, a person to go against, basically. And we're going to have... No, you go with him.
Can you pair? No?
Oh, okay.
It's very easy. I can be your partner.
And we're going to have one person putting their hands up like this, and the other one putting the finger underneath the hand. The finger and the hand don't necessarily have to touch.
But close.
The aim of the person with their finger is to run away from the hand, and the aim of the person whose hand is on top is to catch the finger.
You decide what.
You're not
you have to go like, I try to catch my... All right. No, you're doing it right.
No, it's the other way,
right.
sorry.
No. All right, one more time.
You're grabbing me.
I got it.
Do the best out of 5.
You have so fast.
Fun.
All right, your turn. No, your turn. You have to run away now.
It's fine. Good job, everyone. And now off to a well-deserved coffee break.
Yeah. Thank you.
Thank you very, very much. And we will take the discussion for this item on our return from coffee. Thank you.
Let us get started with the discussion on the points that we previously discussed. And I would like to open the floor to the member states to see if anybody has any comments. Yes. So I see Hungary. Please, you have the floor.
Thank you very much. Chair, honourable members of the Regional Committee, colleagues, I have the honour to speak on behalf of the European Union and its member states. The ongoing health challenges our region is facing require robust and effective governance, transparency and strong leadership to guide us through complex crises and ensure better health outcomes for all. This year's accountability report illustrates that strides made toward enhancing transparency, accountability and governance in our region. We commend WHO Europe's leadership in fostering open dialogue with all member states, as well as its commitment to empowering national authorities. This shift is focused closer to the ground, ensures that actions are better aligned with the specific need and realities of our diverse region, and follows the strategic direction of the GPW14. We support further efforts to meaningfully strengthen the country level, including the implementation of the regional strategy for collaboration between the WHO Europe and its member states and the great work of the SCRC subgroup on WHO's country work and to improve agility in responding to health emergencies and routine challenges alike. This, along with the investment in capacity building and staff training, demonstrates that empowering leadership at all levels improves outcome. The European Union fully supports the continued emphasis on enhancing the leadership capacity of WHO staff in the field, ensuring that decisions are made effectively and locally where they are needed more. Furthermore, we support continued efforts to develop leadership training for member state representatives and hope for the expansion of such programs. Additionally, we recognize the importance of building and strengthening partnership. The regional director's commitment to engaging with member states and other international organizations has proven critical to advancing our shared health priorities. The high-level missions and the proactive engagement with multilateral fora have further ensured that health remains a top priority on the global agenda. We also support the efforts of the regional office to make engagement with non-state actors more meaningful, raising from the NASA fora from exchange of best practices to involvement in decision-making, partnership, and collaborative platforms, including with the WHO Academy and academic institutions. By continuing these efforts, our region can serve as a model for engagement also globally and at the national level in tackling health issues. The Governance Review, commissioned in 2023, provides important recommendations that we believe will further enhance the efficiency, inclusivity, and transparency of WHO Europe's governance. The adoption of 16 key recommendations aimed at improving the effectiveness of the RC and the SCRC marks a significant step forward. We encourage the continued implementation of these recommendations, which are crucial for adapting to the rapidly changing health landscape. Effective governance structures are at the backbone of the responsive and resilient health system, and the EU and its member states will continue to support this process and to engage within the governing bodies. We would also like to thank the SCRC, particularly the governance subgroup, for their efforts. Among others, we can see progress in the nomination process for elected bodies in terms of transparency and predictability. In addition, we welcome WHO Europe's effort to modernize its governance through digital transformation. The introduction of cloud-based systems and innovative tools such as the generative AI not only increases operational efficiency, but it also likely to strengthen the region's resilience in the face of cyber risk and other digital threats. In an increasingly interconnected world, these developments are essential to ensuring the security and adaptability of our health governance structure. Finally, we commend the progress made in ensuring financial sustainability and accountability. WHO Europe's commitment to improving financial transparency and ensuring that resources are allocated effectively is key to maintaining trust and collectively addressing the region's health priorities. We particularly value the focus on resource mobilization and financial management, which are essential to sustaining the region's health program and initiatives. However, we are still concerned about the persistent pockets of poverty and the underfunding or fluctuating funding of several programs, which have a daily operational impact on the predictability and sustainability of work in the field. In conclusion, the European Union and its member states reaffirm our strong support for the governance and leadership reforms undertaken by WHO Europe. We commend the regional director and the secretariat for their ongoing efforts to strengthen governance, enhance leadership capacities, and promote health equity throughout the region. We remain committed to working closely with the WHO Europe and fellow member states to ensure that our collective efforts lead to better health outcomes for all. Thank you very much.
Thank you very much, Hungary. The next one on the list would be Slovenia. The floor is yours.
Thank you, Chair. Distinguished colleagues, while Dr. Kluge has left, Slovenia aligns itself with a statement made by the EU. We would like to say that if not before, now, after so many crises, we do understand that to navigate complex health challenges, it is vital that governance is inclusive and responsive. We commend the progress made under the regional director leadership so far, as evidenced by the European Accountability Report. And yes, transparency and accountability are essential for ensuring trust and the effectiveness of our shared actions. We would also like to thank the SCRC for their efforts to improve governance processes and make the work of the organization more relevant to the needs of countries. Dr. Kluge said that there are so many initiatives and topics to comment, and yes, they are, and we only are given 3 minutes, so allow me to focus only on partnership. Yesterday, Dr. Kluge shared with us many stories of success. We could add one where WHO Euro has supported Slovenia in its presidency to EU, together with the European Observatory. We have explored how we could best combine resources at EU level when developing and implementing innovative solutions to further strengthen our healthcare systems and make them resilient and responsive. Considering that the Monti report is still relevant, and I'm looking at Martin McKee sitting there, still relevant, he's nodding, and I suppose that regional director would be nodding too. Yes, he's nodding, he's here with us now. Okay, so if the Monti report is still relevant, and listening to you, Dr. Kluge, speaking of innovation, we believe we should continue to work together and promote strategic investments in innovative solutions. And in doing so, we, and I'm speaking of WHO and the member states, we should strive to invest in stronger partnership with, for example, the European Commission and also other relevant international organizations. The citizen is one, so we should align our actions to serve him or her best. We ask you to promote regional director, and invest in such approach. Speaking of partnerships, we see another opportunity in engagement with non-state actors, especially non-governmental organizations. But here I will give the floor to our youth delegate to speak to you on this.
So in Slovenia, we have a vibrant network of NGOs, including organized youth, doing incredible work in advancing public health. Public sector continuously provides support to NGOs, from funding to recognition of their work. In Slovenia, NGOs play a crucial role in health, in decision-making, but also in increasing health literacy, addressing the needs of vulnerable populations, promoting public health measures, and advocating for stronger public health policies. My country emphasizes that collaboration with NGOs on the ground is where real change happens. By involving citizens, including us, young people, in decision-making and implementation, we ensure that health interventions are relevant and responsive to the needs of those that they serve, and that there is a feeling of ownership by all involved. We would like to thank the regional office for preparing, together with partners, an engagement plan with NSAs, which outlines a very comprehensive approach. This truly captures what we, Slovenia, were after when we proposed the resolution on social participation. Thank you.
Thank you very much, Slovenia. The next one on the list would be Czechia. The floor is yours.
Chair, Regional Director, distinguished delegates, ladies and gentlemen. The Czech Republic aligns itself with the statement delivered by Hungary on behalf of the European Union and its member states. In terms of budget matters, we are of course concerned, as several other member states, about the underfunded areas, which include also medicines, vaccines and devices. The European region has experienced several problems with accessibility of medicines in recent years, and we are all well aware of the importance of ensuring medicines to our patients. This is one of the reasons why the Czech Republic has joined the Novel Medicines Platform in the role of Chair of Working Group 2 on Solidarity. We hope that progress in this area will be achieved through the implementation of the planned projects, which have been drafted by a large number of stakeholders who contributed with a significant number number of working hours devoted to official meetings, internal discussions, and preparation of these projects. We welcome the division of the RC agenda into 3 days based on the and nature of the discussions. This is a practice that has proved effective. We are a bit concerned by the statement that fewer but generally longer documents were permitted for RC73 and would like to make a plea for the readability of background documents. The structure should be concise with using the executive summaries and similar features. As we continue to support the implementation of the strategy for collaboration between the WHO Regional Office for Europe and member states in the WHO European region, we are glad to see the emphasis on flexibility in the model for working with individual countries. The model piloted with Germany is very interesting and inspiring, and we would welcome more information to be shared on this experience. For example, during one of the future open meetings of the SCRC subgroup on country work. When mentioning the SCRC methods of work, let us appreciate the focus on the enhanced visibility of its activities and its openness to further outreach to non-SCRC members. This is still a work in progress and cannot be slowed down. On the contrary, in this context, we would like to emphasize that the collaborative approach with a strong accent on the country needs is very appreciated. After the re-election of Dr. Kluge, we can rest assured that this attitude will continue. Thank you very much for that. The Czech Republic stands ready to continue its close cooperation with the regional office and looks forward to further progress on the above-mentioned points. Thank you very much.
Thank you very much. The next one on this is Norway. Please, the floor is yours.
Thank you, President, Regional Director, colleagues. We welcome the WHO Euro's commitment to accountability and transparency through the Regional Office Annual Accountability Report, ensuring that Member States have sufficient insights into how WHO is structured, managed and governed at a regional and global level is an important prerequisite to strengthen the level of trust needed for more predictable and flexible funding. We recognize the need for mutual accountability and would, to this end, welcome a more detailed account of relevant risk assessments and challenges beyond the scope of financial constraints. We appreciate the measures that are put in place to respond to Member States' requests for a more operative regional office with country impact. At the same time, we reiterate that the strengthening of WHO's country offices must not be at the cost of the core mandate of WHO at a global level. Furthermore, we request the introduction of new models of providing technical support to Member States, including the country support teams. We appreciate that models may enable Euro to provide tailored and targeted support to its members, while preventing unnecessary fragmentation or duplication of expertise in the Euro workforce. Finally, we draw attention to the high levels of Euro staff reporting symptoms of burnout. We recognize that it has been a turbulent time in the region and thank staff and non-staff personnel for their tireless efforts. We trust that the WHO Regional Office will put in place measures to provide adequate support to its workforce. Thank you.
Thank you, Norway. And the next one is Monaco. Please, the floor is yours.
Monsieur le Président, Monsieur le Directeur général régional, chers collègues, je souhaiterais intervenir sur la santé est l'une des priorités de la principauté en matière d'aide publique au développement et l'aide aux populations les plus vulnérables constitue le fil directeur de notre politique. Aussi, Monaco se mobilise pour apporter un appui constant aux actions de l'OMS Europe et nous nous félicitons du partenariat solide que nous avons construit au fil des temps. Soucieuse d'assurer un financement durable en faveur de l'organisation et de répondre au mieux aux besoins des populations, la Principauté a souhaité conclure à l'OMS des accords pluriannuels. La durée de ces accords correspond à celle du programme général de travail et cela illustre notre volonté de garantir une prévisibilité de notre soutien. En outre, dans un contexte international complexe où les difficultés sur le terrain ne font que croître, Monaco restera attentif afin de répondre à sa mesure aux besoins de l'organisation pour agir en cas de crise sanitaire et humanitaire. Je vous remercie.
Merci beaucoup pour votre contribution. If there are no any other interventions, anybody else from the member states would want to take the floor, we would pass to our international partners, and I would see the Russian Federation. Please.
Chair, I'm sorry, can we clarify which agenda item is this? Because half of the stage was referring to the budget and other half was talking about the previous agenda item.
Thank you so much. I can clarify that we're still on agenda item 6, the discussion on agenda item 6. The accountability report is introduced, which includes information on budget. The budget matters item, which is agenda item 7, will immediately follow. Thank you.
Yeah, please. The floor is yours if you have some comments on that point.
Да, спасибо большое за уточнение. Уважаемый председатель, уважаемый региональный директор, уважаемые коллеги, благодарим секретариат за доклад по вопросам подотчетности и отмечаем его. Вместе с тем, в следующих докладах хотелось бы увидеть более детальную отчет о персонале, включая разбивку по категориям и уровням должностей. Также необходимо уделить внимание функции оценки, инструменту для отслеживания качества реализации программной работы, в том числе указать, какие за прошедший год были проведены мероприятия по оценке, какие планируются на следующий год в рамках региона, как сотрудникам используются выводы и рекомендации по итогам. Еще хотели бы отметить, что помимо сюжета сексуальной эксплуатации и насилия и домогательств, необходимо освещать и проблематику мошенничества и коррупции среди сотрудников и то, какими методами осуществляется борьба с этими явлениями. По проекту программного бюджета мы твердо убеждены, что для принятия странами взвешенного решения по очередному повышению обязательных взносов необходимо, чтобы секретариат предоставлял детальную информацию о планируемом использовании бюджетных средств. И для этого недостаточно указывать в проекте бюджета лишь программные цели и задачи. Крайне важно, чтобы финансовая составляющая программного бюджета сопровождалась такими основополагающими элементами, как статьи расходов или Objects of Expenditure. Без понимания того, сколько именно секретариат намерен потратить на персонал, командировки, закупки, другие важные цели, а оценить адекватность размера бюджета и обоснованность очередного повышения взносов просто не представляется возможным. В проекте бюджета также целесообразно указывать планируемое штатное расписание на двухлетний период. И государства-члены уже неоднократно подчеркивали необходимость включения этих данных и выражали заинтересованность более углубленно участвовать в вопросах управления ресурсами. Кроме того, мы ожидаем, что в преддверии рассмотрения проекта бюджета руководящими органами ВОС секретариат представит подробный аналитический обзор эффективности предыдущего раунда повышения обязательных взносов. Обращаем внимание на намерение секретариата разработать системного многообразия, справедливости и инклюзивности. Призываем секретариат воздержаться от использования терминов и подходов, которые не пользуются единогласной поддержкой государств. Мы также убеждены, что в рамках стратегии ключевым элементом должна стать проблема обеспечения справедливой географической представленности стран. И в завершении хотели бы отметить, что у нас есть также дополнительные замечания к проекту бюджета, но в целях экономии времени мы не будем их озвучивать, направим в письменном виде. Благодарю за внимание.
Thank you very much, Russian Federation, and thank you for giving the comments in written, which helps us for the sake of time. If there are any other comments from the floor, we would like to pass to our international partners, and I would like to ask anybody who wants to make a comment on this subject matter to raise its nameplate so we can give the floor to that person. No. If we have no comment at this moment, I would propose that we move on to the NSAs. where the Secretariat has received a request for a joint statement delivered by European Patients Forum, EPF, on behalf of Eurocam, European Federation of the Associations of Dietitians, European Forum of National Nursing and Midwifery Associations, European Patients Forum, European Public Health Alliance, International Diabetes Federation Europe, International Federation of Medical Students Associations, International Society of Physical and Rehabilitation Medicine, International Society for Telemedicine and E-Health, Movendi International, Women in Global Health, World Federation of Hemophilia. Dear Madam, you have the floor.
Thank you, Chair. Dear Regional Directors, dear colleagues. As our healthcare systems face growing challenges, from rising health inequalities and access barriers to emerging public health threats, the need for is more urgent than ever. Participatory approaches directly affected by health policies help inform and shape decisions. Meaningful engagement fosters transparency and public trust, not only in healthcare systems, but also in policy making and in our ability to respond effectively to people's needs. Civil society organizations are of open, democratic societies. In healthcare systems, CSOs bring to the public debate the voices of patients, carers, professionals, experts, people with lived experience of health conditions, and many others. This helps bridge the gap between policymaking and what truly matters to citizens. However, shrinking civic spaces have confined civil society organizations to a narrowing advocacy role, with advocacy campaign outcomes as the primary measure of impact. By contrast, in May 2024, the World Health Assembly resolution on social participation acknowledged that we, NSAs, can and should be much more. We can be participants in decision-making, true and equal partners to policymakers. By approving the resolution, WHO member states have committed to facilitating this critical societal role. The co-signatories of this statement express our strong support for the NSA engagement plan presented at this regional committee session. We welcome the plan's focus on fostering active and open dialogue, formalizing structured mechanisms for collaboration with NSAs, and leveraging NSA expertise to support WHO Europe's work at all levels. The plan brings together established work streams with ambitious future goals. The very process of developing the engagement plan exemplifies this commitment. NSAs were heard, our asks were answered, and our contribution integrated. The idea for a regional NSA engagement plan began during an NSA dedicated session at the last RC in Astana and was followed up promptly and collaboratively. This is a model of what we've been asking for: early engagement, co-creation, and meaningful dialogue and respectful dialogue. To secure the long-term sustainability of the plan, we would like to propose as a first step collaborating on the development of a monitoring framework with clearly defined short-term outcomes and longer-term targets. At EPF, we're in the process of developing a barometer of patient organizations' involvement, which can also help with this framework. We really believe that monitoring and benchmarking are the key to identify priorities, better understand potential roadblocks and solutions, and highlight best practices. As we move forward with implementing this strategy, however, we call on member states and the WHO to recognize and help address ongoing political and operational challenges to the sustainability of civil society organizations. We urge member states to allocate budgets for sustaining this essential dialogue and clarify how enhanced consultative processes can be supported by reliable and transparent funding. We also call on the WHO to help contribute to the sustainability of NSAs through joint work and fundraising. We recognize and praise the value of the NSA engagement plan and look forward to working with WHO to translate it into concrete actions. We express the signatories' commitment to making it a tool for bringing more and diverse voices towards better health outcomes for all and more equitable healthcare systems. Thank you.
Thank you very much for these points. And now we should have one individual statement by the European Nursing Students Association. Over to you, please.
Honorable delegates, respected colleagues, and partners in health. Today, we, the future nurses of Europe, gather with deep gratitude and immense sense of purpose to support the WHO Regional Offering Plan with non-state actors. We, as nursing students, represent healthcare's future, and this plan not only acknowledges our role, but has reignited in our profession. The commitment to dialogue, institutionalization, and collaboration assures us that our voices matter, our dedication is recognized, and our potential to shape healthcare is valued. WHO Europe's vision has made us proud, showing us that we have a rightful place at the table, where our insights, our passion, and our care can guide the health policies of tomorrow. We envision a future where nurses are not only caregivers, but also essential leaders in health systems that are resilient, compassionate, and inclusive. This engagement is not just a strategy. It is a promise that nursing students across Europe are integral partners in building a healthier world. We stand ready to fulfill this role, empowered by your trust and inspired by your vision. On behalf of the European Nursing Students Association, thank you, WHO Europe, for giving us the chance to contribute, to collaborate, and to carry forward the art of healthcare. Thank you.
Thank you very much. I'd like to thank everybody for the interesting and fruitful and pertinent comments. I would like to give over to Gabriel Jacob, maybe to start with the response.
Thank you so much, Mr. Chair, and thank you to Hungary on behalf of the EU, to Slovenia, to the Czech Republic, to Norway, to Monaco, and to the Russian Federation for your comments. With regard specifically to the accountability report, we really appreciate your welcome for the report, but also your guidance in terms of how we can continue to strengthen it, to ensure mutual accountability for outcomes in our region. So we very much appreciate the guidance that you've given to us. And of course, the accountability report and your interventions this afternoon demonstrate the interconnectedness of the different parts of the report itself. So we will have a dedicated session on the programme budget immediately to follow, where my colleagues may wish to address some of the comments specifically on the budget and financing side, on the funding side. If I may, in addition to what you've guided us on this afternoon, if a few points, please, because I think they're very pertinent to designing the work of the Standing Committee in the next year. The first is the emphasis that we heard on continuing to make the work of the Standing Committee visible and ensure that that work is that all member states are informed about that work, so that you know the work that is being done on your behalves intercessionally. I very much heard from a governance perspective the messages in relation to continuing to work on both the length and the timeliness of our documentation, taking account of what we've already achieved. With regard to the guidance on the accountability report itself, very much welcome the guidance around enhanced risk assessments in relation to human resources, and we will take those messages away and work on that for next year's accountability report. With regard to the novel medicines platform, thank you very much to Czechia for your chairing of Working Group 2, and your guidance is very much heard in that regard. As colleagues will recall, we did have an information note with the RD's report on the progress on the novel medicines platform this year. And with that, I would like to pass the floor, first of all, to my colleague Christina, who may wish to pick up points in relation to the country strategy, and then my colleague David Allen with regard to human resources, including burnout. Christina?
Thank
Thanks.
you very much. Thank you very much. I think it's fantastic to see a youth delegate also in your delegation to RC, and I think France was calling up for that our NSA engagement plan launch on Monday to have more youth delegates in regional committee delegations. So in terms of engagement plan of NSAs, I think we look forward to work together with you to put it into action and walk the talk. Then Czechia, yes, we are happy to provide more information on the country support teams, particularly I think you are making reference to, but our targeted and strategic support against very clear deliverables. We can bring up the Germany example. together with Germany, because it's a co-creation, but also the other countries which I mentioned in one of the standing committee meetings, or what fits the best. Norway, I think you made also reference to the country support teams, a tailored time-limited support to countries. And I think what makes us proud is that we are aligning ourselves as one WHO to deliver to countries as one WHO. And I think this is also an opportunity to engage with other, such as WHO collaborative centers, but also the experts from your sister and brother countries, which may bring the relevant experience to be shared. And then I think, last but not least, our NSA colleagues, I think, yes, your voice matters, and you have a place around the table, as you said, through the process to develop the NSA engagement plan, but also putting it into action together. And last but not least, monitoring framework, yes, because I think we all believe here in WHO Europe that what gets measured gets also done. So thank you very much, and I will end in the interest of time. Thanks.
Many thanks, Christian. David, please. David, the floor is yours. Thanks.
Yeah, thank you, and specifically thank you to Norway and Russia for the comments on the accountability segments. And I think, as Gabrielle mentioned, a lot of them are about how to improve this report in the future, and we take them very well. And maybe a couple of the points that were raised on the risk assessment challenges, apart from the financial, we are working on this. This is again one of the new service lines that hopefully we'll be able to present something clear to the regional committee next year. On strengthening the country offices without impacting on the regional and global, this is something that we're going to touch upon in the next section on the budget matters. But just to give some kind of a response, this is in fact a tricky balance, and where the sweet spot lies is where we're trying to figure out. And I think this also comes to the issue of the country support teams and how they can fit in or not in terms of our business model and trying to deliver the quality of services and products at program level that member states expect of us with the amounts of resources we have. So this is a work in progress, and we're having a senior leadership team retreat just after this, where this will be discussed. In fact, this is high on our agenda. On the burnout concerns, this is exactly why has really put a lot of resources to this. And we've decided now to do the next survey only in 2 years to allow a little time for all this work that we're doing on team-by-team action items to try to address pain points. And so we would be able to report back after 25 on the next one. We're not running one this year, but we're confident that our work will help move us towards a more safe and more pleasant and comfortable workspace. Also with Russia, I think these are a lot of the reports that you're asking that you mentioned would be good to have, specifically on the HR statistics. These are reported to the WHA region by region, and I'll look at how we can potentially have a table also in the accountability report for your reference when you're reviewing our regional committee. That's clear. I think the other on the audits, again, this is something that is managed centrally, as well as the investigations. So we would have to leave that. We don't have the information on the plans for audits. We do speak with iOS on a yearly basis on what the next year's plans be, but we don't have confirmation until the next year. Yeah, and I think the other questions were more for the program budget, and they'll be taken up then. Thank you.
I think to sum it up, I think you're fully right what you've been working on over the last months as well, in looking how can we become more transparent, more open, and gain the trust. And I think this is important. And I think Norway and some others mentioned that. And this is something that me, as well as incoming chair for the next 12 months, would also like to focus on, because it's really important. Only if we know what we do with it, you and all the member states feel comfortable in contributing and in going to the same direction. This is very important to us, and I think we have already discussed some of the things will come, some of the things will be more difficult to show, but I'm very confident that we will improve. So for that, I think we can conclude this agenda item. We are now ready to consider the adoption of the proposed draft decision contained in UR/RC74/conf./3 on engagement with non-state actors, accreditation of regional non-state actors not in official relations with WHO to attend meetings of the WHO Regional Committee for Europe. Is the committee willing to adopt the proposed draft decision by consensus? I see no objection. Then I would say then we can therefore adopt the things. Thank you very much. And this concludes then agenda 6. You are really right. I think for this point, I would like to pass the floor again to our chair, Adriana. Please take it from here.
Yeah, thank you very much, Thomas.